It is Heart Health Awareness Month, and all month long, we are focusing on your heart health with our ABC 15 Health Insider. We know that heart disease is the leading cause of death for women. So that's our focus this morning as I'm joined once again by Dr. Shad Marbasti. Good morning, Dr. Shad.
Good morning, Noelani.
So, why are women at a higher risk with heart disease?
Well, there's several reasons why. One of the reasons is actually a lack of recognition by doctors, although that is changing because mostly physicians had also really assumed that women were not as impacted. Although now that is being changed, and actually in medical school, I'm teaching that to our medical students. Another reason is because of atypical symptoms. The symptoms for heart attacks or strokes, particularly for heart attacks, are very different. And so it's not easy to recognize that those are symptoms of a heart attack because they're not your typical well-known symptoms of a heart attack. And then biologically, women actually have smaller arteries than men. So the development of the narrowing of the arteries, known as coronary artery disease, actually looks a little bit more different in women. So when they do that angiogram for men, you can see those big vessels being blocked. But for women, they may have all of those more smaller vessels actually blocked, and you may not actually catch that. And then there's delays in getting care. A lot of times women are more, not necessarily going in. Maybe they're going to take their husband in, particularly for heart disease, but they may not think that they themselves have heart disease. Again, because culturally we've kind of thought about heart disease as something that impacts men more than women, when the reality is 1 in 3 women are actually dying from heart disease.
And what's really interesting about everything that you just said is that all of those factors are not necessarily genetic that put you at risk. It's a lot of social. And we know that women, at least in the last year, the latest study has shown women carried more stress than men, which is also a major risk factor.
Absolutely. And stress is huge. It's on par with high cholesterol, high blood pressure, smoking status in terms of the risk, and women having disproportionate amount of stress, chronic stress, which leads to chronic inflammation and all the chronic diseases of our time, like heart disease.
You said that the signs of a heart attack for women are a little different. They present a little differently. So, what are the key things that women should look out for, and what do they do when it happens?
So I think if you feel off, if you feel tired, if you feel short of breath, if you even just have neck or throat pain, definitely if you have jaw pain, but even if you have just back pain, kind of mid back or upper belly, kind of what we call epigastric, kind of like the middle upper part of your belly, these are kind of more typical symptoms in women. So it's not that crushing left-sided chest pain, but it can be all of these other things that women should look for and get screened, right? We talk about going red, getting your numbers as early as, mid 30s and definitely into our 40s. Women should definitely get tested, check their blood pressure, get their cholesterol checked, and then potentially get a stress test. If you are short of breath often with physical activity, go get a stress test, and we can see whether or not you have some kind of underlying heart disease that needs to get treated.
Wonderful jumping off points so that you're at least aware of the changes that might lie ahead for you. And of course, we will be talking more about specific ways to turn your life around as well this month as we focus on heart health. Dr. Shad, thank you for your time. We will see you again next week. And in the meantime, if you have questions for our ABC 15 Health Insider and other medical topics that you'd like to see discussed, email us healthinsider@abc15.com.